Case counts lately, a good thing as the state looks to reopen more and more. But state health officials also say there are a lot more unconfirmed cases out there than you might think. So today we asked how many. Here's News 13's Brittany Bade.
Kim, state data shows roughly 2,000 fewer people are getting tested per day than around this time last month.
We'd like to continue testing as many people as we can. The more we test, the more we can be assured that we're finding all the cases and then contacting those people and getting them isolated and getting the list of their contacts and quarantining those people.
Now you can see on the right-hand side of this graph where we recently dipped below the state's target of 5,000 tests per day. The state is also using what it calls a positive test multiplier, which estimates the number of actual COVID cases in New Mexico may be 3.4 times higher than the number of confirmed cases over 2 weeks. Now, using that analysis, the state estimates there could be more than 5,000 COVID cases across the state right now. Nationwide, there is a 15% increase in confirmed child cases, and while kids tend to have an easier time with COVID, Dr. Grace acknowledged the struggles families are dealing with. He encouraged creating a COVID-safe bubble if you can.
If you have a family where you feel safe, having those regular interactions can be one way to give the kids an outlet to deal with people their own age that aren't their parents, which is probably really important for all of us.
Dr. Grace also mentioned New Mexico is about 6,200 flu shots ahead of last year's pace, which is a good sign as health officials are encouraging everyone to get a flu shot this season. Back to you, Kim.
Brittany, now we did ask more about how the state is tracking COVID testing in children. We'll have more on that coming up at 5:30.